Okay, ways that we administer fluids. We could administer fluids sub-Q, and basically we use this for mild to moderate dehydration on non-critically ill patients. It could be a patient that has chronic renal failure and the owners are just wanting to keep the quality of life going. We usually give about 10 to 15 mLs per site. It's given usually over the scapulas in that nice area where we get the nice skin tent. And you need to make sure that you only use isotonic solutions when you give sub-Q fluids. There is a risk of infection. I will tell you there are devices that you can use to make sub-Q fluid giving easier if it needs to be given long term. You can look that up on the internet if you want to find more information out about that. So, and the best way that we give fluids would be IV. And this is intravenous. We place an IV catheter, and we use these for moderate to severely dehydrated patients or hypovolemic patients. You also use IV fluids during surgery. And this is to make sure that we, one, have access in case of an emergency, two, so that if we need to keep their blood pressure up while we're doing surgery. And with IV catheters, you could do crystalloids, colloids, or blood products. When you're doing IV catheters, you need to watch for a few things. You need to make sure you're watching for fluid overload. A patient that has nasal secretions, lung sounds that are kind of harsh, they could be tachypneic, so breathing hard, their demeanor is increased, their PCV and total protein drop. These are things you want to check if you're giving them fluids over the long term, because a fluid overload is just as dangerous as being dehydrated. The other thing to know about IV catheters is you need to check them frequently to make sure they're flowing properly. They should be flushed, and it should be changed every 48 to 72 hours. Some other ways of administering fluids, IO or interosseous. These are fluids that are given via the bone marrow. They use these with neonates and exotics. They place it in the femur or the humerus. It is a sterile procedure. It's generally something that you do if it's the last ditch attempt. Everybody has to be sterile. You can't cause damage to the bone. I have even seen them fracture the bone when they're trying to place the catheter in. So PR is also called rectally. This is good if the patient doesn't have diarrhea. It gives you really good, quick, rapid electrolyte absorption. IP, intraperitoneal, it's in the abdominal cavity. If you use these types of fluids, it could cause sepsis. It's not really good. You can't use hypertonic solutions with it. They aren't quickly absorbed. As a matter of fact, they're more quickly absorbed with sub-Q fluids than they are with IP fluids. So these are some ways that you can give intravenous, or you could give fluids.